In this time of Zoom and virtual conferences, we get very frequently asked if we can do the new patient exams or the consults, via Zoom. And we can. It's just that I wanted to kind of break down what we actually do during our new patient exam. So patient comes in, and the first thing we do is we ask kind of like a history questionnaire. I want to get to know the patient before we actually start to look in their mouth, and that involves a lot of key questions so that I kind of know why they're here or why they're seeking the treatment that they're seeking. And then we get into oral cancer screening. Then we take photos. We take measurements of the seal that the gum line forms around the tooth, because the seal of the gum line is really the only thing that acts as a barrier that keeps bacteria from getting into our bodies, if you think about it. So that seal, if it's measuring 1, 2, and 3, that's healthy. If it's measuring 4 or higher, it's unhealthy. So we chart everything. Then we take films, digital films, so that we can measure bone levels and see if there's stability issues where teeth are loosening, see if there's receding gum line. We take a plaque sample, we put it under the microscope, and we have a live plaque sample on a large monitor so that the patient can actually, for the first time in many cases, see exactly what this infection means. And it's basically the bacteria. They get to see that on the screen. And I explain that the bacteria causes inflammation. The inflammation activates your immune system. And then the toxins that are produced from this whole thing is what starts to eat away first at the seal of the gum line. And it gets deeper. That's why a pocket forms, reaches the bone. The bone actually starts to get destroyed. Tooth loosens, falls out, etc. So there's so much that goes into our co-discovery exam. It's very, very difficult to do an assessment via Zoom or via emailed photos. However, we still encourage you to email us as much information as you can, because in that way we can start the screening process and see exactly which direction we're going to go in terms of your periodontal problem. So it's all good. It's just that we can't formulate a plan or a diagnosis based on such limited imaging. So I hope this helps, and at the end of the day, it's really going to save us a lot of time to do things right on the front end and plan the case accordingly from A to Z.